Skin RN here with another video. This time I'm offering 3 tips on how to prevent ostomy leakage. Unfortunately, those with an ostomy, leakage can be a problem, and so I'm hoping that these 3 tips serve as a starting point for prevention. My first tip is you need clean, dry skin. When we say clean, ideally you're using just plain warm water and a washcloth to pat dry. That is it. Why? Because if you use things such as baby wipes, soaps, alcohol, lotions, powders, these are things that can leave a residue behind, reducing the adhesiveness of a pouch. So that's why plain warm water and a washcloth is all that's recommended. The second tip is you want to ensure a proper fit of your appliance, but that starts with measuring your stoma. Here's what happens. When you first have ostomy surgery, your stoma is swollen because of that bowel manipulation, but that swelling typically subsides over a period of about 4 to 6 weeks. So what that means is that you need to measure your stoma to ensure the right fit. But here's what happens. Very often patients will continue to cut their appliance to the size that they were immediately post-op, and that's a problem because now you have peristaltic skin that's exposed, and now output gets onto that skin and causes damage, but also undermines a pouch, causing leakage. And so this is why it's very important to measure your stoma for about 4 to 6 weeks after surgery on a weekly basis to ensure the proper fit. And lastly, less is more. And I'm guilty of this. When I first started out as an ostomy nurse, I used paste, rings, because I really did not want any leaks for my patient. But what I've realized over time is that less is more, and very often you're able to get away with just cutting the pouch and putting it on without any accessories. So I highly recommend being conservative and not using more than you need to, because having an ostomy is overwhelming in itself. And so if we can keep things simple, that would be better. Now, if you do need to add more because maybe an ostomy nurse recommended it, then maybe you can do so in incremental steps to see what little you need in order to get the job done. I hope that makes sense. So there you have it, my 3 tips, which are clean, dry skin, ideally with just plain warm water, pat dry, the skin must be dry, measuring your stoma to ensure a proper fit, and I'll talk more about convexity in future videos. And then lastly, less is more. Keep it simple. All right, I hope you found this helpful. Please subscribe so that you can stay tuned to whatever other tips I have to offer for you. Thanks so much. Bye-bye.